This week, it's time to set aside the Jewish focus of this podcast and instead talk about the big news affecting everybody, the 2019 novel coronavirus and the pandemic it has caused. There's a lot of news out there and it can be hard to keep up, so consider this an overview of the basic things you need to know based on current information. I'm Lev Gringaus, and welcome to The Jews Are Tired, your podcast about Jewish news. So before getting further into this episode, I just want to be clear about the purpose of this podcast. I am not a medical professional. I am, on the good days when I can ignore the fact that I'm a college student, a journalist. Like most people, and in fact most journalists right now, I've basically crash-coursed my way through the coronavirus by reading much of the reporting that has come out and listening to interviews with medical professionals. And there is a lot of reporting out there. In fact, there are a lot of interviews with medical professionals out there. But what I'm hoping to do here is take that original reporting other journalists have done and the information gathering that medical professionals have done and put it in one place and present that information in as clear a way as I can, so that you can be and feel more informed and less overwhelmed with the anxiety-inducing cycle of news that is drowning us right now. And to be clear, it's drowning everybody, from the people who follow the news to the journalists writing it. According to the World Health Organization, as of Tuesday afternoon, there are over 184,000 confirmed cases and 7,529 confirmed deaths worldwide. And the numbers continue to go up. Several countries like Spain, Italy, Israel, and others are basically on lockdown. Across the United States, schools are being canceled, universities are sending students home, restaurants are being ordered to close, and gatherings of large amounts of people prohibited. There is a lot going on. But there's also a lot of misinformation and confusion out there. So the idea here is to cover some basic things. What is the coronavirus? Is it like the flu? Are we all overreacting? What should we be doing? What's up with testing? And what comes next? As a warning, this will not be the happiest of episodes, but it will have information you should know about the coronavirus. Links relating to all the information I'll be sharing will be in the podcast notes. And for those who need to avoid the news for mental health reasons, I'll just give the short answer right now. It is worse than the flu. No, we're not overreacting. Stay home if you can and please wash your hands. You most likely can't get a coronavirus test if you need one, and no one knows what really comes next. The rest of this podcast focuses on explaining why. So with that in mind, let's dive in, starting with absolute basics. What is this coronavirus thing causing this pandemic? So the 2019 novel coronavirus emerged in the Wuhan province of China in December of 2019. Doctors and medical professionals still don't know exactly how the virus emerged, but the running theory is basically that it jumped from bats to another animal and then to people. As to how it spread, there were reports in China of a new pneumonia-like disease in December of 2019, but at the time those reports were basically covered up by the Chinese government. So person-to-person transmission of the virus continued, helped along in early 2020 when there was a lot of travel happening in East Asia for the Spring Festival, which is commonly known to many people as the Chinese New Year. Not to mention, other regular travel by citizens of all countries to and from China also contributed to the spread. From there, the 2019 novel coronavirus spread around the world, with the first case in the United States confirmed on January 20th. And I can't say that without taking a moment to recognize that right now, January 20th feels like a lifetime ago. We'll come back to the importance of this date in just a little bit. For the sake of clarity, I should also say, the 2019 novel coronavirus, or what is now officially named SARS-CoV-2, technically causes the disease that we know and regularly refer to as COVID-19. I'll try to just refer to both the virus and the disease it causes as the coronavirus from here on out. Also, this is not the Chinese coronavirus. It is not a foreign coronavirus, as President Trump, and let's be real, mostly Republicans and right-wingers have referred to it. Anti-Asian hate crimes have spiked since the coronavirus started spreading. Now is not the time for racism or idiotic incitement to racism when referring to a disease. It is the coronavirus. That's it. So let's keep going on what the coronavirus is, because that's an important way to also talk about what it isn't. Coronavirus as a category of viruses range from the common cold to the flu to diseases like Ebola and this 2019 coronavirus. Now, because it's in the same family as the flu and it's also been killing people, the 2019 coronavirus has been compared to the flu a lot. And mostly in the times that I've heard and seen the comparison, it's been used to say, well, the flu kills some people every year, it's fine, we're overreacting to this new thing that is basically just like the flu, don't shut anything down, don't worry about it, we'll be fine. And the short rebuttal of this is, no, it's not like the flu. That is a wrong comparison to make. And the longer rebuttal is this. Humans, generally speaking, have an immunity to the flu. No, not an absolute immunity, of course, but our bodies and our immune systems, which tackle diseases on the whole, know the flu and can recognize and respond to it. We also have vaccines to help people develop an immunity to the flu. We have special antiviral medication and treatment, and we have flu tests that can tell you if you have it or not in something like 20 minutes. We have none of those things for the coronavirus. There is no vaccine, no medication, no special treatment, and in the United States right now, very few tests at all, which is something we'll come back to later. Because let's talk about death rates. As a warning, this will get morbid, but I want to be clear about this because an NPR poll that just came out Tuesday morning shows that 20% of Democrats think the threat of the coronavirus is being blown out of proportion, 54% of Republicans think that too, and so do 41% of independents. And here's why those people are wrong. The death rate for seasonal flu is about 0.1% and often even lower, according to the World Health Organization. The death rate for the coronavirus is estimated anywhere between 1 and 3%, with sometimes even wider margins. To explain what that looks like, here are some numbers from the Centers for Disease Control on the flu. The CDC estimates that between October 1st, 2019 and March 7th, 2020, a maximum of 51 million people got the flu, and that a maximum of 55,000 people died because of the flu. That's right around that 0.1% death rate. There will be a link to the CDC estimates in the podcast notes, because there is a minimum bound of estimates, but I'm going through the maximum numbers here just so that we can understand what these percentages mean. So now, if the flu death rate was 1% instead of 0.1%, that would mean around 510,000 or over 500,000 deaths. If it's 2%, that's over 1 million deaths. Now factor in the fact that according to CDC modeling, the coronavirus could infect anywhere between 160 million to 214 million Americans, or roughly speaking, somewhere around half the population of the United States. If we take that lower number, that 160 million, and say that the coronavirus's lowest death rate estimate is 1%, we end up with 1.6 million deaths. If the death rate is 2% in this scenario, we get 3.2 million deaths. The numbers go up when more people get infected, compared to the maximum estimate of 55,000 people who died from the flu. Still a tragedy, but not the same as millions of deaths. Now let's take a step back for a moment, because this is not easy information to take in. The point here is that however you cut it, the coronavirus is much deadlier than the flu, and all the lockdowns and the social distancing and closing down schools and restaurants, all of it is warranted. And here's where I also have to be honest about the fact that while medical professionals are sure that the coronavirus is deadlier than the flu, no one actually knows the death rate. Right now, various studies and health organizations are estimating based on different projections. If you just divide known deaths by known causes in an area, you might end up with a much higher death rate than if you assume there's also a lot of people who get the coronavirus but show few or no symptoms and never get officially counted. There's also a much higher death rate for patients over the age of 50, as the coronavirus hits middle-aged and elderly people particularly hard. But children seem to be largely unaffected by the coronavirus, though they can still be carriers for the virus, and young adults tend to be okay as well. And I also have to recognize how confusing a lot of the information on the coronavirus is right now. On one hand, The coronavirus is deadly and much deadlier than the viruses we're used to dealing with. On the other hand, based on data from China, 80% of coronavirus cases are mild. Now, what that means is actually up for some debate. Some medical professionals are saying that mild means few or no symptoms, while others say mild can still mean serious pneumonia-like symptoms. Where the dividing line seems to be, again based on data from China, is that 80% of people with coronavirus don't need to be hospitalized and recover on their own, 15% end up needing to be hospitalized, and 5% become severe cases. Again, all of this depends on location and who is in that location. In parts of Italy, for example, where a lot of elderly people live, many more coronavirus patients need to be hospitalized and many more patients have severe symptoms. We need to be cautious about applying statistics and understand that we're in the middle of a pandemic with a new disease. There's still a lot of information gathering happening and a lot we don't know. And the bigger picture is that no matter how comparatively easy of a time 80% of people have with the virus, we still have to take care of the other 20%. There are also more factors that can affect death rates and how a country handles the coronavirus, which I'll get back to in a moment as it involves talking about the broader response to the coronavirus. So let's first reiterate how we individually should be responding to the coronavirus. The most important thing as a general rule is wash your hands with soap and water. That's the most effective way to kill bad germs, bacteria, and viruses. Hand sanitizer is only effective against viruses if it's over 50 or 60% alcohol, but soap is the best. Next general rule, do what we're now calling social distancing. Keep your distance from people if you have to go out somewhere, and if you can, please stay home, stay put, and do not go out. Definitely don't do what lots of stupid people are doing right now and go to the bar or to restaurants or to a party or to the beach. Remember those scary statistics about how many people might get infected in the US and how many could die? The whole point of locking down the country and staying home is to cut down on the spread of the coronavirus and stop any situation from getting that bad. We're doing this to save lives. And as the virus hits the elderly particularly hard, we're doing this to save our parents and our grandparents and our great-great-grandparents. Also, face masks and medical gloves, don't buy them. You don't need them. The people that need them are patients and medical professionals. The coronavirus spreads by airborne droplets and particles. It's not airborne, but it can be carried through the air in small droplets. Doctors and nurses need masks that are specially fitted so that no coronavirus-infected droplets or particles reach their nose or mouth so that they don't get sick so that they can continue caring for patients. Patients need masks to avoid spreading the droplets. But if you don't have the virus, don't buy the masks. Most commercially available masks can stop you from spreading droplets, but not from inhaling them, so they don't actually offer any protection from getting sick. And the specially fitted masks, again, are for medical professionals who know how to fit them. We don't have an unlimited supply of these face masks. Don't buy them. Also, stop buying all the toilet paper and don't hoard all the food. We have enough of both in this country, and please be kind to one another. So that's all part of the individual level avoiding the coronavirus plan. But what if you feel symptoms that you think are coronavirus? Well, first of all, here's the information the WHO provides on symptoms. Quote, the most common symptoms of COVID-19 are fever, tiredness, and dry cough. Some patients may have aches and pains, nasal congestion, runny nose, sore throat, or diarrhea. These symptoms are usually mild and begin gradually. Some people become infected but don't develop any symptoms and don't feel unwell. Most people, about 80%, recover from the disease without needing special treatment. Around 1 out of every 6 people who gets COVID-19 becomes seriously ill and develops difficulty breathing. Older people and those with underlying medical problems like high blood pressure, heart problems, or diabetes are more likely to develop serious illness. People with fever, cough, and difficulty breathing should seek medical attention. End quote. Second of all, if you think you might have the coronavirus, don't rush into the doctor's office and do not go to the ER. Call your doctor or a doctor's office or a clinic's office. Call first, talk to someone who knows what they're doing, and then go by what they tell you. The last thing anyone needs is people rushing to hospitals and clinics and the ER room and infecting everyone else there. Also, cocaine, gargling bleach, zinc supplements, drinking warm water, none of these things will cure the disease. Holding your breath for 10 seconds is not a way to test for any disease, and definitely not the coronavirus. Don't get caught up in misinformation. Call a doctor, go to the CDC or the WHO websites for information. Third of all, I've seen some doctors in a number of interviews recommend that because 80% of cases have flu-like symptoms, the symptoms can be addressed by common over-the-counter medication that people would take anyway if they thought they had the flu. To be clear, this over-the-counter medication may help alleviate symptoms. They will not cure the virus. But again, the most important thing is to call your doctor and go by what they tell you. And this brings us to the bigger picture of how the country should be addressing the coronavirus. Shutting down universities, restaurants, in-person gatherings, getting everyone who can to work from home. All of these things help keep people further apart physically and limit the spread of the disease. Limiting spread means limiting deaths. The other big way this country should be addressing the coronavirus is to test everybody to know who has it, who doesn't, and figure out a way to properly allocate resources to care for people. The response is built on having reliable information. And this is now, unfortunately, where we get to part 2 of why we're not overreacting to the coronavirus, and this situation is very serious and likely to get much worse than statistics tell us. Because the truth is that nobody knows how many people have the coronavirus in the United States. Why? Because coronavirus testing for most of the past 2 months has been a failure. Let's just start with a basic question. Can you get tested for the coronavirus? The answer, even right now, is probably not. There are a lot of reasons for this. Back in January, the genome for the coronavirus was sequenced and a number of tests were put together into a list by the WHO. The WHO offered these test protocols or instructions to countries around the world. The United States and the CDC, for reasons that are still unclear, declined the WHO protocols and decided to create their own test for the virus. And at first, the test worked. But then the CDC started shipping testing kits across the country, and it ended up that those testing kits had faulty components. Everyone knew the CDC kits didn't work by around February 6th, and it took until late February for the CDC to fix the problem. But what was the actual issue with the test kits? Well, the CDC still hasn't really explained that, but it's important to understand what these tests are. Basically, a doctor or nurse swab the inside of a patient's nose or the back of the throat. That swab goes to a testing lab, which uses special equipment to extract RNA. Once that's done, the RNA is turned into DNA and copied over and over and over and over again. Then a dye is added to the sample, and it's compared to known coronavirus DNA to see if there's a match. If there is a match between the patient sample and the coronavirus sample, that's a positive test. If not, that's a negative test. The important thing to know here is that specific machinery and materials are needed to separate the viral RNA, turn it into DNA, and to multiply it millions of times. The test also requires that the coronavirus DNA that patients are being matched to isn't contaminated. The CDC test had a combination of a shortage of materials and a part of the coronavirus DNA match that was coming back with inconclusive test results. So that cut down drastically on available testing, and so did the fact that only some labs have the machinery to run the test, which still remains true right now. But it gets worse. The CDC and the Food and Drug Administration had such stringent regulations on who can and should be doing coronavirus testing that state labs, private companies, research organizations, and academic institutions that could have been testing and that in many cases developed their own coronavirus tests couldn't do so. There's a pretty infamous story at this point of a flu researcher in Seattle who had been collecting patient samples from across the state of Washington, where, on January 20th, the first U.S. case of the coronavirus was identified. This researcher, Dr. Helen Chu, realized that she had all of these patient samples, and instead of testing for the flu, she could start testing for the coronavirus. But the CDC and the FDA got in her way and told her no. The red tape and the bureaucracy and the regulations told her no. And guess what? She got so fed up that she did start testing and in fact identified the first case of community transmission of coronavirus in Washington. And then she was shut down. The FDA only fast-tracked approval of non-CDC testing on February 29th. To make it even more complicated, there aren't enough testing kits and supplies right now because not enough were ordered, not by the CDC and not by anyone else because they weren't allowed to order supplies or make tests by the FDA and the CDC. And the cherry on top of all of this, partly because of the lack of supplies and partly because of state, federal, and hospital guidances and regulations, testing is mostly reserved for people who can prove they either were around someone who has coronavirus or who can prove they traveled abroad to an infected area. What this means is that community transmission or the spread of the coronavirus to people who didn't travel anywhere and may not know who they got coronavirus from, that's not being tested. There are countless stories even of doctors and nurses begging to get tested for coronavirus after treating infected patients, and the hospitals refusing to give them a test because, well, they didn't fit the criteria for who should be getting tested. Because of this, even as testing right now is ramping up with CDC and FDA approval, the US tested fewer people than Vietnam for most of the past several weeks, and we have no idea how far the coronavirus has actually spread. What that means is that we don't know how many people will get sick, and we don't know how many people are at risk of dying because of the coronavirus. And this also means we don't know how our healthcare system will manage the inevitable surge of patients. There's a really common graph that's popped up across social media and that's being used by journalists to show that without social distancing and shutting everything down, a lot of people will get sick all at once. And if that happens, hospitals won't be able to cope with all of those patients, and doctors and nurses will have to decide who lives and who dies based on who gets the limited supplies and resources needed to help severe cases. The hope is to do what's called flattening the curve, which stops this spike of people getting sick and instead minimizes the number of cases and spreads that number out over a longer period of time so that hospitals stay within capacity and can care for all the patients. How do we flatten the curve? Again, socially isolate and shut everything down. The problem is there are already reports from across the United States of hospitals that are overwhelmed with people who have severe symptoms. Do these people all have the coronavirus? With the shortage of testing, for the most part, we don't know. Do hospitals have enough resources and beds to care for all the severe cases? No matter how you count it, and medical professionals have been counting lots of different ways, the answer is no. Can we get more supplies, more beds, more of everything? Well, that takes time to order and produce, and we may not have that time. In many ways, we're already reaching the place that Italy is at right now. Italy did not respond strongly enough to the coronavirus, and now they're living out the nightmare of doctors and nurses deciding who lives and who dies based on the limit of medical supplies, the severity of cases, and the overcrowding of the hospital. Now, this may sound hollow, but I'm not saying this to make us panic. I'm saying this because we have to know what's going on, even though the brutal problem is that we largely don't know what's going on. I promise the podcast next week will focus more on the positives in this situation, and if you've listened this far through this episode, thanks for sticking with it. This is a really scary time for a lot of people, and honestly, everyone who isn't at least a little scared, now is the time to get scared and stay home. We should also keep in mind, and if you pray for the medical professionals on the front line of the pandemic, the underpaid restaurant and supermarket, and all the other service workers who are delivering and stocking up food and supplies and making sure this country continues to run at risk to themselves and largely without paid time off. And if you can donate for food, for the homeless, and for those in need, please do so. And pray for the journalists working hard to report accurately on this crisis in a time of massive misinformation. Somehow we will survive this, and things will get worse before they get better. But so as not to drown in negativity, I want to leave you with one of my favorite quotes in the world from Rabbi Lord Jonathan Sacks of Great Britain. In an interview, Sacks once said, quote, "Optimism is the belief that the world is going to get better. Hope is the belief that if we work hard together, then we can make the world better." No Jew knowing what we do of history can really be an optimist, but no Jew ever worthy of the name ever gave up hope." End quote. So my prayer to you this week, and for the rest of the time that we're caught up in the situation, let's not give up hope. This has been this week's The Jews Are Tired podcast. I'm Lev Gringauz. Don't forget to subscribe and share, and hopefully next week the Jews will get some rest. The Jews Are Tired is a product of Jewfolk Inc. For more information, go to tcjewfolk.com or email the show at podcast@tcjewfolk.com.